They're all doing the same thing. All the unions are here. It's great to see everybody here. But we really have to stand up to these people. Maybe my colleagues out there all over Ontario are fighting out there day by day by day with being stopped by Code 7s in the hospital, being delayed for hours and hours and hours while patients sit on our bed. Delays in when we transport you to the hospital, sometimes they're on consideration or time consideration, meaning if we go to one unit. I had a patient a few weeks ago that had fallen and had an eye injury, and we were transporting to Met Hospital, and the hospital refused to take him because there was no beds.
Shame!
So we had to transport him to Hotel Dieu, and he was in critical shape. Thank God we got there quickly, but that's one of the delays that's going on right now. There's no money that the government's putting back into the hospitals. You remember years ago, Windsor used to have 4 hospitals, 4 ERs. Now we're down to 2. They may have given us more beds, but there's a lot more people in the city now than what there was 20 years ago. The population has increased dramatically. We all know the Ontario government has made all kinds of promises to increase the health care here for seniors. We are the second worst in Canada. That's terrible. I have an aunt here in a local nursing home, and I see the care that goes on. And I see the nurses and the RPNs and stuff want to do more for her, and they can't because the money's not there. Because the money's going back into those people's pockets, thanks to Mr. McGuinty.
It's a disgrace.
Boo!
Support the frontline workers.
We got to stand up here and say no more. No more to him, no more to his government, taking money out of the taxpayers' pockets and put it into profit. It's come time to an end. I'd like to see if Mr. McGuinty or Mr. Duncan, when they get older, they're wearing a diaper, and see if they wear it till it's blue and it's pouring out the sides. See how they like it.
Shame!
Exactly, no more. We as the taxpayers and unions in this province, we need to stand up once and for all and voice our opinions. Go to your neighbors, go to your friends, go to your families. We all have people out there that are being affected by cancer and how long it takes to get cancer treatment. It is now over. We're gone back 30 or 40 years. It's just ridiculous. We used to have the best healthcare system in this country. And I can imagine Tommy Douglas must be just rolling over in his grave right now 100 times a day, just seeing what's going on with the people out there. And
Shame!
Shame!
Exactly. It's time we got to get over the Bob Ray days. We've got a lot of good people out there. I see Joe Martin out there in the crowd. We have a lot of good NDP people out there right now, and now it's time for change. We need to support these people and put them back into power to make that change. There's approximately 7,000 paramedics in this province, and when I heard the other day that there's a possibility they're closing Leamington, Sydenham, and Petrolia hospitals, that means myocardium. Myocardium means time. If it takes me longer to get you to the hospital, that means your heart muscle starts dying, and it's irreversible. So I think it's time for change. We have to stand up now. It's come to an end. The system is busting apart, and as the taxpayers here in Ontario, we have to make change. Thank you.
Yes!